COVID-19, the illness caused by a novel coronavirus, has become a pandemic, which means many people should expect to have it around the world. Earlier in this video series, we talked about the chain of survival behaviors and the links of preventing the spread and how to prepare specifically for COVID-19. And then the second link, the recognizing the signs of early infection, so that we can respond effectively in reducing the spread and knowing that we can help. In this video, we look at the third links of first aid and accessing help, specifically for COVID-19, and the helping behaviors that we can have for ourselves and for others, and knowing when and who to contact when we need them. Fever can be expected with most infections, and this is when we want to put our plan into action about keeping people isolated, comfortable, both physically and psychologically, or if it's you, putting yourself out of the way of others. As of March 17, 2020, the safest anti-fever medication is acetaminophen. If a fever reaches 100.4 or goes higher, you should seek the advice of your medical professional. If possible, use your telehealth option for your own self to keep you away from others and people away from you. There also might be some public health lines available. For coughs, dealing with those, you can use a cough suppressant. A drug known as dextromorphin acts on part of your brain called the cough center to reduce the urge to cough. However, breathing difficulties can lead to a life threat. So if you observe shortness of breath, difficulty breathing, persistent pain in the chest, new confusion or inability to arouse somebody, or bluish lips or a bluish face, those are your signs that you need to call your emergency services. Remember, this also may go along with a high temperature, 103 to 104, despite medication. You may have some bloody sputum or increasing chest pain that goes with this. While waiting for EMS to arrive, you have the opportunity to put that person in a position of comfort where they can breathe the easiest. And that may be up to that person, whether it's sitting or laying. Listen to your person. One of your good resources during this time might be the First Aid app from the American Red Cross, which can be helpful in knowing when to call or to seek advanced care for emergencies like this. It also has some other really great first aid topics that might happen while you're in isolation. COVID-19 should not be an excuse for you staying at home in a life threat. Call your emergency services early. In the next video, we'll take time to look at what are those self-care pieces that we can do once we're exposed, and what we can do to keep other people safe, or if advanced care is needed, and what do they do.